43 minutes past 6 o'clock, the U.S. House passes health care. Its signature from the president from becoming the law of the land. Our state legislature working on bills against the federal health care bill. Pat McGuigan from CapitolBeatOK.com joins us with the detail. And Pat, I mean, the big thing, Idaho has already passed a law that it's automatic. Idaho is going to sue the federal government over this health care bill. Virginia is going to sue as well over the mandate that its citizens have to buy health care insurance. But what can state governments really do? Doesn't federal law, in all cases, trump state laws, no matter what the states do?
Well, unless the federal law violates the Constitution itself, which sets up levels of government and separation of powers. Health care, as has been said 1,000 times in this debate, health care is nowhere in the Constitution. So the argument that will be made by states like Idaho, possibly by Oklahoma, is that it was a violation of the federal government's limited enumerated powers. Now, the courts have shifted on that a little bit over recent years and begun to nip and tuck at the federal government's expansion. So it's not a slam dunk that this doesn't eventually get reviewed by this Supreme Court or one much like it.
We have 4 bills in our state legislature concerning this. We also have a constitutional amendment coming up in the November vote, right?
Yes, and what these are protective or limiting on the reach of the federal provisions. To give you a quick example, there's a widespread belief that Oklahoma's existing limits on public financing of abortion will survive because they pre-exist the passage of this and don't directly conflict with the new law. So there's an example of something that might be litigated but would be left in place when it was all over.
Also, there's this little matter about the budget still being talked about at the state capitol.
Yes, this week is a very interesting and important week because the real work will be done in the committees, not necessarily on the floor of either the House or the Senate, and that's where they're beginning to deal and grapple with the very difficult challenge of the 2011 budget.
Workers' comp reform, likely, but failure comp source. What does that tell you?
Work comp, there will be further changes in the work comp system, a smaller number of judges, limits on their terms, and some believe that that'll lead to a better work comp system. On the flip side, the proposed sale of the comp source system or program looks like it's not going to go through, and there might not even be mutualization, so that may remain a public-private agency with a lot of government power. The case for it was pretty strong simply because you would have been able, if you'd sold it, to get a big chunk of money all at once and put it against some of the debt problems we're facing.
Finally, Pat, there have been a couple of gun bills in the state legislature. Where do those stand?
Second Amendment's very popular in Oklahoma, including with Democrats, and Senator Sweden is probably one of the bills you're referring to. It's an expansion of the Make My Day law, and some people have said it may be driven, this is not clear to me, but it may be driven by the incident on the South Side where the young man was killed by the convenience store worker, to make it clear that that's a reasonable use of force. It's a pretty controversial bill, but on the other hand, Oklahomans think that a man or a woman's home is their castle, and the same with the business.
All right, Pat McGuigan, OK, CapitolBeat.com.
Thank you.
All right, I think I didn't get that exactly.
CapitolBeatOK.com.
Yeah, I think I had the OK in the wrong spot. All right, thanks a lot.